My name is Katherine GeeBah Footracer. I'm an NCCPA-certified physician assistant. I've been a PA for 12 years and kind of think it's the best job ever. In LA in March, I was working in my primary care clinic, and at that time, at the beginning, there were so many uncertainties about COVID, how it was transmitted, how it was not. I'm Navajo. And while I was brought up in Los Angeles, I don't have a strong connection to the Navajo culture. I started reading more about the Navajo reservation and how the COVID pandemic was devastating it. And I felt called to help. I knew I had to do something. As a certified PA, I knew that my skills would be useful in a medical setting. So I emailed Indian Health Service my resume and asked how I could serve as a volunteer. And then I packed a car and drove out to Kayenta in Northeast Arizona, not really knowing exactly what I was going to get into. At that time, I had very few patients with COVID-19, whereas in contrast, on the reservation, every patient I saw had friends or family with COVID-19, and most of my patients knew somebody who had died from it also. Probably about 90% of the patients I saw during that time were positive for COVID-19. The patients I saw in Kayenta on the reservation were a big mix, anywhere from 8-year-olds up to 80-year-olds. Sometimes we'd have 5 people from a family come in, and 4 would test positive, 1 would test negative, and then we'd have to figure out if the person negative was a child. How do we help arrange for care? Who gets care? How do you set stuff up so that the one person who's not been affected so far can be protected? The Navajo reservation in LA are such worlds apart, distance-wise and culture-wise, but that same distance makes it really hard to get to healthcare. I would have patients who'd be driving an hour to get to us because we're the nearest location. But a specialist might be 2 or 3 hours away, which is a huge barrier to care if you can't get there easily. And because there's a lot of underlying health conditions on the reservation, things like diabetes, blood pressure, when people get sick with COVID, they get sicker than they do in Los Angeles. So the death rates were much higher. And about 1/3 of households lack either running water or electricity. So you can imagine how difficult that makes it normally to kind of keep perishable food for more than a couple days. And that if we're telling people to wash their hands 20 seconds, multiple times a day, for somebody who doesn't have running water, that's really impossible. On the reservation, people were taking it very seriously, and there was a lot of fear, but I think in some ways there was less misinformation going on. And that's in part because the cell and internet service is pretty spotty out there. So people were getting most of their information from places like our health center and the Department of Health. But what struck me as a bigger difference actually was the attitude. In LA, people were taking it somewhat seriously. I'd hear about parties and gatherings still, but on the reservation, it was being taken deeply seriously, and it was seen as a community effort. Everybody I saw was wearing masks. People were following very restrictive curfews, and there was a real focus on the community's need to protect the elders and the other vulnerable people in the community. I had one patient who told me she'd been sleeping in her car for a week. She had COVID-19, and she was sleeping in the car because she didn't want to risk anybody else in her household getting it. Even though she had a separate room she could stay in, which is what we recommended, but to her that was too risky, and she so wanted to protect her family and her loved ones that she was staying in the car in the yard for a week. The COVID pandemic is real, and so many people are suffering from it. Too many people are suffering from it. We all need to do our part, which is physical distancing, wearing face coverings, staying home when you're sick, so we can end this thing. Also, the pandemic has been bringing to more attention the health disparities that affect American Indian communities and other communities of people of color. And I hope that when we return to a more normal life again, that it's a new normal, a better normal, that's more just and equitable for all of us.